Welcome back to Champions of Care, presented by Oakwood Healthcare. Today, we're talking all about shoulder pain. And with me is Rahul Jadia, a physical therapist with Oakwood Healthcare at Oakwood Heritage Hospital. Rahul, welcome.
Thank you. Thank you for having me.
Now, Dr. Milia mentioned that not all shoulder injuries require surgery and that physical therapy and rehabilitation can somehow do the trick. Can you tell us about that?
Sure. It's not uncommon for physicians, including surgeons, to send their patients to physical therapy prior to attempting more aggressive measures. Oftentimes with physical therapy, we can alleviate shoulder pain, restore shoulder function, as well as avoid shoulder surgery altogether.
And if someone is referred to physical therapy at Oakwood, what should they expect?
Well, I think we're often misled to believe that one pill or one machine can cure us completely. At Oakwood, we go with the philosophy that in order to achieve a complete recovery from any injury, including shoulder injuries, it's important that physical therapy have a multifocal approach. That approach starts on day one with your initial visit. We do a very thorough patient evaluation, and based on that evaluation, we gain information that allows us to create a treatment plan that's customized for each individual patient.
Oh, I like the notion of a customized treatment plan. What are some of the elements of that customized treatment plan?
Well, we start by looking at posture and body mechanics. If you take, for example, a skinned knee, if you skin your knee, regardless of how many Band-Aids you put on that knee, if you continue to put pressure on it, if you continue to kneel on it, it's always going to hurt. The same principles apply for your shoulder. If you continue to put pressure on irritated structures in the shoulder, you're going to continue to have pain, and it may not heal. So in physical therapy, we assess your posture, the way you hold your arm, what you do throughout the day, and how your arm impacts your activities, your workstations, your activities at work, including your ergonomics. And then we take those assessments and adjust those activities to allow you to have optimal healing with the least amount of pain.
And what is range of motion and mobility? What does that really refer to?
Well, when you have shoulder pain, one of the most common strategies to cope with it is to just not move the shoulder. So what you'll find is that people won't reach up to grab something, or they won't lift things. They won't use their arm for activities they previously would have. As a result, what happens is all the muscles in the shoulder region become very tight. In addition to the muscles becoming tight, the shoulder joint becomes very stiff. In physical therapy, we not only go through and loosen the muscles of the shoulder and neck region, but we manually loosen up the shoulder joint. We mobilize the shoulder joint.
You manually do that? That sounds like it might hurt.
You know what? People often are fearful of pain in physical therapy, but the truth is, when those mobilizations are done to a shoulder that's not moving very well, most patients feel better afterwards.
Ah, they feel relief.
Absolutely.
Now, are there certain muscles that should be strengthened through physical therapy?
Absolutely. The rotator cuff muscles are the ones that are most commonly injured with shoulder injuries. The rotator cuff is a group of 4 muscles that's responsible for shoulder stability as well as shoulder movement.
And does the therapy change if you've already had surgery for shoulder pain?
It does, in the sense that in addition to the areas that we normally would look at, we also want to consider pain management as well as the healing times of the surgical procedures that the surgeon has performed on that patient. At Oakwood, we try to maintain a very close relationship with the surgeons and the physicians, so we're always aware of the timelines and protocols that each surgeon prefers to ensure that that surgery has a successful rate of healing.
So someone will come in, you'll create a personalized treatment plan for them, you'll help them through the therapy, and then are they supposed to do the exercises outside of therapy as well?
Oh, without question. Realistically, you're only in therapy up to 3 hours a day. 3 hours a week. As a result, the other 165 hours you're on your own. So your therapist will teach you a detailed home exercise program, which you can do while you're in therapy, as well as an exercise program that you can carry on after therapy to ensure that you don't have the same injury again.
Now, is there, to people who are watching with some shoulder issues, some shoulder pain, they're not sure what, they don't think it's serious enough to go see a physician just yet, what general advice do you have for shoulder pain and shoulder health?
The interesting thing about shoulder injuries is that every shoulder injury is unique. It's very difficult to compare one injury to another. So being that they are so unique, education is the key. through your physician and through your physical therapist, it's important that you have an understanding of your shoulder's anatomy, as well as how your particular injury impacts that anatomy. Once you have that education, then you need to be taught how to recover from your injury, as well as what you can do in the future to keep from being in a situation where you have a shoulder issue again.
Now, this shoulder pain sounds like a really serious thing. Is there one thing that people who don't yet have a shoulder problem should do to make sure they never have a shoulder issue?
Again, because shoulder injuries are so complex, I hesitate to give you one thing. But what I would tell you is that I think if you're not really comfortable with the idea of how to avoid shoulder injuries, you really want to seek a medical professional, whether that be your physician or your physical therapist. They can guide you through a program that would include stretching, strengthening, posture and body mechanics, and a home program that potentially could keep you from having shoulder problems in the future.
Rahul Jadia, you are a physical therapist. You practice at Oakwood Heritage Hospital in Taylor, Michigan. Thank you so much for being with us today and helping us understand physical therapy for shoulder issues. Thank you.
Thank you for having me.
And when we come back, we'll hear about a high school baseball coach who got his life back thanks to shoulder surgery.